The Madison County Community Health Center has been in existence for 16 years. The people that we serve are uninsured, underinsured. We've been assigned over 6,000 patients by the Medicaid panels through the state of Indiana. Since February of last year, when Indiana expanded to the HIP 2.0 program, the Medicaid program, we have enrolled over 2,000 families. That's 2,000 families that didn't have health insurance. So between the Affordable Care Act and the Healthy Indiana Plan, we've reached out to people who, had the Madison County Community Health Center not been here, they may not have been able to find somebody to help them get enrolled into taking care of themselves with preventative or care plans.
4 years ago, I had a little accident. I got my finger in the car door, but I am pregnant. So my husband, he is scared because it's a lot of pain. And I remember one lady, she told me, "That's okay, don't worry, I help you." So I comfortable. And that time is 4 years ago, and I come in again because I am pregnant, so I'm really excited. I feel very happy. I'm not scared anymore.
I'm a business guy. We do a lot of home remodeling, some real estate work, investing, that kind of stuff. I was aware of it kind of on the periphery for quite a while, but then I began to run into neighbors and friends who worked here. And all of a sudden I began to realize the common denominator that they had, which was a servant's heart. And then as I began to refer guys and gals who work for us, and I would bring them here, then I began to really realize the ministry that goes on.
It has been a tremendous help to me. It saved me. It got me through some very dark times. It is needed. And I fear for people like me with fibromyalgia. Along with that goes depression, because you live literally every single day in pain. And this is the place to get your help, your medical and your behavioral, your psychological treatment. The staff is so pleasant. I have like almost a personal relationship because I've come here for so long.
I mean, Madison County Healthcare Center, they helped me through a lot. I mean, if it wasn't because of them, I probably wouldn't be how I am now, a lot happier.
I started coming here when I first moved to Anderson. There are still so many people that are either not covered or underinsured if they're insured. And this place fills a niche that I don't think that people in this city and in this county realize.
That was a family of 3 children, and they were scheduled to see me for their wellness checkups. So that was my first encounter with the family, and I was surprised to see that mom has not been taking her children to doctors for years. I asked her why, and she said because they have never been sick, so she never thought that there is any need for any wellness checkup. Anyways, I mean, I saw all of them, and one of her daughter, who was about 5 years old at the time, she looked very pale. I mentioned this to her, but mom does not, didn't seem very concerned. She said, no, she's just very white, she's very active and healthy otherwise. So we did their examinations, their routine checkups, we did their normal screening labs, and next day I was called, that was a panic call from the lab, that hemoglobin of that girl was extremely low. So we asked to do certain more testing, and unfortunately that girl was diagnosed with the leukemia, acute lymphoblastic leukemia, and she was referred to Riley Hospital, started on chemotherapy, and I feel very proud to say that she's in remission right now. She's still undergoing chemotherapy, but she was diagnosed at early stages and responded very well to treatment. we actually called that family because that family was listed as one of our old patients. So we always contact our old patients and try to bring them in for their routine preventive care checkups.
Madison County Community Health Center reaches about 30% of the residents of Madison County with some type of service, whether it's medical, dental, behavioral. Going forward, we want to expand that number and reach those people who have not been able to get preventative care. Our goal is to expand to reaching over 10,000 people every year. So we're looking forward to reaching more people with integrated services all under one roof that include medical, dental, and behavioral health.